Hello everyone, welcome back to Exam Key Point Dentistry. Today we will discuss an important oral surgery topic for BDS exam, management of the post-extraction hemorrhage in medically compromised patient. So this topic is very important for BDS theory exam, Viva question, clinical case discussion. So watch till the end. So what is hemorrhage? So hemorrhage, it refers to the excessive loss of the blood due to the rupture of the blood vessels. In simple words, when blood vessels break and too much blood come out, it is called hemorrhage. So classification based upon percentage of the blood loss. So this is very important for the exam. So class 1 hemorrhage, it is up to 15% blood loss. Class 2 where 15 to 30% of total blood volume loss. Class 3 where 30 to 40% of blood is lost. Class 4 where more than 40% of blood loss. So remember, class 3rd and 4th are dangerous and it is need emergency care. Now based on source of bleeding, so there are 3 types. Arterial bleeding, so it is bright red in color, comes like sprouting jet, it is very dangerous. Second one is venous, so it is dark in red, continuous steady flow. Now the third one is capillary bleeding, so oozing type, it is very mild. So here the Viva question is which bleeding is white, which bleeding is bright red and sprouting. So answer is arterial bleeding. Now, according to the type of bone, so hemorrhage is classified into primary hemorrhage. So it is occur at the time of extraction of the surgery. Okay. Now the second one is reactionary hemorrhage. That is, it is occur within the 24 hours after the surgery. Now the third one is secondary hemorrhage. So it is occur after 7 to 14 days, usually due to the infection. Okay. So here the important for the exam is secondary hemorrhage is commonly due to the infection. Now the next one is clinical classification. So here it is revealed or external, that is the soft tissue injuries, concealed or internal, accidental hemorrhage, postpartum hemorrhage, and the hemorrhage due to the premature detachment of the placenta. Okay, so this one is clinical classification. Patient with a systemic condition like a hemophilia, liver disease, thrombocytopenia, anticoagulant therapy, warfarin like renal disease, hypertension, and need special care. Okay, so it will need special care during the extraction. Now the general principle. So always remember these 5 points. Take detailed medical history. Okay, so assess the medical history thoroughly. Consult the physician or specialist if needed. Do atraumatic extraction. Okay, so there will be minimum trauma during the surgery. Use local hemostatic measure and keep emergency drugs and IV fluid ready. So this is a common 5 marks question in exam. Now the first one is hemophilia and hemophilia coagulation factor deficiency. So first identify the factor, that is a hemophilia A factor 8 deficiency and hemophilia B, that is a factor 9 deficiency. Okay, then give factor replacement therapy. Okay, we will give replacement therapy. Give desmopressin for mild hemophilia A. Avoid nerve block injections. Okay, so here the image show gelatin sponge. So this one is gelatin sponge and how it is placed inside the extraction socket. So after the extraction, we place the gelatin sponge inside the socket. It helps in clot formation and control the bleeding. So it is absorbable and safe. Okay. Now the second one is intraoperative management. So we use the atraumatic technique. Local and hemostatic agents like a gelatin sponge, oxidized cellulose, and fibrin glue. So Viva here commonly asks the name the local hemostatic agents. Okay, so you have to remember this. Now the post-operating care for the hemophilia. First we will do sutures the socket properly. Use Tranexamic acid mouthwash and avoid NSAIDs. Use paracetamol for the pain. So here the important MCQs is why avoid NSAIDs? So because they increasing the bleeding. Now the second one is patients on the anticoagulant, that is example is warfarin. So very common exam question. So first check the INR where it is international normalized ratio. So if INR is less than 3.5, so extraction can be done safely. But if INR is greater than 3.5, so consult physician to adjust the dose. Do not stop warfarin routinely. Okay, so for the management, use the local hemostatic agents like gelatin sponge, Tranexamic acid mouthwash, and sutures to secure the clot. So very important line for Viva is never stop warfarin without physician consultation. Now the third one is liver disease and thrombocytopenia. So in liver disease, clotting factors are reduced. So first we have to check the PT, INR and platelet count. So it may require fresh frozen plasma may be needed, and for use the local measure antifibrinolytic. Okay. Now the thrombocytopenia, if platelet count is less than 15,000 per millimeter cube, so there is a chances of the high bleeding risk. Okay. So if very low, so we consider the platelet transfusion, perform the extraction in hospitals, and use the sutures and the pressure pack. Okay. So here the Viva question is minimum platelet count is safe for extraction or not. So it is usually about the 50,000 per millimeter cube. Now for hypertension, so if BP is more than 160 per 100, so there will be increasing of bleeding risk. So control the BP before the surgery and avoid adrenaline, that is LA, if necessary. Okay. So local hemostatic measure is, so we do pressure pack with gauze for 30 to 60 minutes, sutures to approximately tissue and retain clot, and using the hemostatic agents like a gelatin sponge, oxidized cellulose, bone wax if bleeding from the bone, fibrin glue or thrombin, and chemical agents like adrenaline, that is 1:1000 for local vasoconstriction, Tranexamic acid mouthwash or tablets, and electrocautery for persistent bleeding. So here it is important short note topic. The post-operative instruction, so what we tell the patient, we tell do not spit for 24 hours, avoid cold compress, soft diet, avoid smoking and alcohol, and maintaining the blood pressure. Here the emergency measure for the severe bleeding, so if bleeding is severe, give IV fluids, hospitalize and monitoring the patient, ICU if unstable, blood transfusion, surgical ligation if vessel is visible. So this is asked in long essay question. So today we learned types of hemorrhage, classification, management in hemophilia, anticoagulant patient, liver disease, thrombocytopenia, hypertension, and emergency management. So this is very important topic for BDS exam. If you found this video helpful, like, share and subscribe to my channel, Exam Key Point Dentistry. Thank you so much for watching. See you in the next video.